Now listen and answer questions 31 to 34.
Good afternoon. Today we're continuing our investigation into obesity. We've looked at several factors causing obesity, including lack of exercise and a general sedentary lifestyle, and the role the media plays in promoting the consumption of high-calorific food. In the coming weeks, we'll go on to examine serious eating disorders, such as anorexia nervosa and bulimia nervosa. The decline in formal eating times within the family and the subsequent increase in the degree of snacking that takes place have had a significant effect on obesity. Today, we're going to turn our attention to an example of this, what has been termed emotional hunger or emotional eating, as opposed to the consumption of food to satisfy a physical need. Studies have uncovered how our emotional state can lead to us eating more than we physically need. It was originally believed that negative emotions brought on through depression or anxiety were the main cause of this. But it is now acknowledged that positive emotions can have a similar effect on our eating habits. Not everyone is susceptible to emotional eating, and even those who do suffer have highly individual symptoms. However, there are common themes. It seems that people who are already overweight are more susceptible to emotional eating when suffering negative emotions than those who are underweight. Equally, excessive eating of this kind can happen during or after happy events, when larger meals than normal tend to be eaten.
Before you hear more of the lecture, you have some time to look at questions 35 to 40. Now listen and answer questions 35 to 40.
So, what are the signs that someone is eating to satisfy an emotional stimulus? Well, there are several differences between emotional and physical hunger. Those experiencing emotional hunger will feel the urge to eat all of a sudden. This compares to the gradual sensation of hunger that occurs with a physical stimulus. Interestingly, and I'm sure many of you will recognize this, when you're eating to satisfy an emotional need for food, the craving will often be for a specific item, like a pizza or something sweet like ice cream. In this kind of situation, nothing else will really satisfy the craving. When the urge to eat is driven by a physical need, you're far less bothered about what you eat. Emotional hunger makes the individual feel the craving must be satisfied immediately by whatever the specific kind of food is. I'm sure we've all experienced that feeling. I must have some chocolate now. In contrast, the need to satisfy sensations of physical hunger seems less urgent. Emotional eaters will carry on eating even when they're full. A person eating to satisfy a physical hunger will be more likely to stop. Finally, and probably not surprisingly, feelings of guilt often follow emotional eating, but not when eating normally. This has serious consequences for those working with patients suffering with obesity. One way to deal with this is to educate sufferers into understanding the different symptoms of physical and emotional hunger, and to try to help them identify the pressure points during a typical day when daily stresses occur. Being conscious of one's eating habits is the first step in dealing with the problem.
That is the end of section 4. You now have half a minute to check your answers.